Welcome back, everybody. We're going to show you some real smiling faces. Why? Because they've gone to Dr. Todd Shatkin from the Aesthetic Associates, and we're going to show you what can be done.
Absolutely.
With sitting in your chair for a little while, right?
It's great to be here, Linda.
Thank you. Nice to have you back.
Yeah, so, you know, we talk all the time about what implants can do for people, whether it's replacing a single tooth or replacing a full set of teeth or a partial set of teeth, or if it's stabilizing loose dentures. But a lot of patients with dentures, they have trouble tolerating the palate, the roof of the mouth being covered.
Yes.
And they have trouble eating their foods. And so on this particular patient, he had a full denture, and he wasn't real happy with the color of the teeth, but his biggest problem was the fact that the roof of his mouth was covered, the dentures moved a lot. And so on this patient, here's the upper arch with no teeth.
Okay.
We did implants. We did the mini implants. We put in 10 implants, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and we did a permanent bridge that got placed over those implants. And this is what it looks like out of the mouth. It's all porcelain, zirconia, with pink porcelain to mimic the gum tissue.
And there's no palate.
There's no palate at all. It's all completely open. And in contrast, this is what he had before.
Oh my gosh.
So you see all the plastic and the roof of the mouth that was covered on this denture.
So uncomfortable.
And so that's what he had before. And this is the permanent bridge now cemented in the patient's mouth. He needs some teeth on the bottom as well, but we're focusing on the upper. And this eliminated that entire denture and the roof of the mouth.
Wow.
And here he is smiling with his natural teeth. And if you looked at him, you'd never know that they weren't his own teeth.
No.
And that's the goal with, but you can see they're whiter, they're a little longer, they fill out his mouth a little better, and looks more natural than he did in the beginning.
And he must get at least like 30% of his mouth back without all that palate stuff
you get 100%. There's nothing on the roof of the mouth at all now.
Amazing.
Instead of, you know, and sometimes when we do dentures, we do a horseshoe denture where we cut the palate out and then stabilize those with the mini implants where they snap in and out. And this is the next step above that, which is just eliminating a denture completely.
And these stay in for him.
They stay in all the time.
He doesn't take those out.
Yeah,
Does he use regular toothpaste?
Regular toothpaste. We give them a water pick to keep it real clean, and then we have them come to the dentist every 4 months for cleanings.
Fantastic.
And maintain their teeth.
Yay!
And of course, ultimately, we'd like to get them some teeth on the bottom.
Yeah.
But it's all about what a patient can handle financially.
Right.
But we do make things affordable, and we also offer patient financing up to 2 years with no interest to cover these type of things if you don't have insurance.
I have only met patients who are thrilled, just thrilled with the results.
Yeah, they really are.
So happy.
And of course, that's the last one. And of course, I can show them the first, the before photo again. But you know, it's coming up to that holiday time, and if patients want to just make a little improvement in the color of their teeth, they want them whiter or straighter, or we can do all kinds of cosmetic procedures to improve, you know, teeth whitening, porcelain veneers, all the things that we talk about all the time.
From this point to the last picture, how many times did he come to the dentist, and how long did it take?
3 visits, less than a month.
Wow.
Probably 3 or 4 weeks.
So when you got to the point where this is how he originally is, because he had false teeth, is this one appointment? Yeah, the implants go in at 1 appointment, and then we take impressions and bite registration, and at that visit we put a temporary bridge in. Either we'll use the patient's existing denture as a temporary, or we make a new temporary bridge for them. And then the porcelain bridge is made in our laboratory right here in Buffalo, across the street from our dental office. We have our dental lab, so it's all made right there. And then at the follow-up visit, they come back and they get their permanent teeth placed. Wow. So even in the process where you just have the implants and you don't have the teeth in yet, but you have the implants that you made, you leave the office with temporaries.
Yeah, patients never leave our office without teeth. Right. No matter what. We never let them leave without teeth. And usually we stabilize their existing denture with those, so they already feel better.
Yeah, amazing. You know, so and just imagine that these are tight, they feel like your own teeth. I would imagine even to your tongue, right up they to feel like your own teeth.
You see it goes right up to the gum line. So and then when they smile, they look really nice.
Wow, that's fantastic. So, wow. Yeah. I can only imagine how many people have been just so thrilled, thinking that they would never have a beautiful mouth. You know, really. Yeah. And you can do it now. You can do it.
Yeah, I had a lady not long ago, just recently, who came in who had been a victim of domestic violence, and she had teeth knocked out, and she had just a really sad situation, and we gave her smile back, and she was just in tears and so happy. So, you know, we can do all kinds of things for people, and we love to help people, and we like to make you happy. So complimentary consultation, just call our office, and we'll take x-rays and do a consultation for you at no charge and see if you're a candidate for these procedures.
Well, this gentleman is certainly happy, I can tell by his smile. But listen, Dr. Todd hasn't not seen anything like your mouth, okay? I mean, you might say, oh, but wait till he sees mine. No, no, no. They've seen it all, okay? And they can still come up with this result. So the important thing is to give them a call, the Aesthetic Associates Center. Really easy to find, 2500 Kensington Ave, Buffalo. They have their lab right across the street, so nothing leaves town. Give them a call at 839-1700 right now, or you can log on and learn more through greatlook.com.